Well, thank you. My name is Craig Kelscher, and with Dr. James Frickton, we founded Seven Realms Solutions. We're a self-funded company that is at a revenue stage right now. We're focused on digital patient engagement around chronic pain and addiction, and that product is called PACT. Pain and addiction is really a huge elephant in the room, and it's really a PR crisis in that there's no real practical response to helping patients. There's 50 to 100 million people that are experiencing a pain condition. There's over $600 billion in annualized healthcare costs spent in this space. The challenge is that patients control much of the outcome through the risk factors and protective factors that they can control to either dial up or dial down pain. The problem is providers don't have the time in a clinical setting or the tools or the training to actually address that. And that's what PACT is. It's a digital platform that's built around collaboration of engaging the patient outside of those 15 to 20-minute office visits. The provider prescribes PACT, and a health coach engages along with the digital platform to work with the patient so they actually understand and learn what they're doing that's causing their pain to be dialed up and what they can do to dial it down. So we help the patient take control. We're right now implemented within 2 clinics. And we're focused on doing 2 things. One, we want to prove the outcome for the patients are actually getting better. The second thing we want to do is prove that the providers can make money doing this. And at the same time, we want to make money as well. So in the end, what we're focused on is making sure that everyone wins. The patients get better because they actually learn how to control pain and dial it down. Providers actually have a tool that they can use to work with their patients and make money. We're targeting around $1,000 additional profit per patient. And we make money by providing the solution on a subscription basis per patient per month.
That's great. We're going to take some questions. Thank you.
Thanks.
Just trying to get some help on understanding what the patient would be dialing up or dialing down. These are meds, or what are you?
No, it's really getting into social behaviors, psychosocial activities, cognitive behavioral changes that they can make. And it actually falls along all of these different areas. What are they doing from a body perspective? Are they exercising, not exercising? Or what are they doing from a lifestyle perspective around diet and some of those types of things? When we move into tier 3, we really start to get into some of the things that drive long-term control, which is really having a purpose in life, having meaning around what they're doing. So it really addresses all of these levels. So when you think in terms of the assessments and the micro-training and the work that the health coach does with the patient, they cover this whole curriculum. It takes about 6 months.
How does the curriculum interact with their day-to-day life? I mean, what does it look like when someone's actually going through this?
So when they log in, they do an assessment that helps them understand where are their problems, where are their protective factors, and then these micro lessons are actually delivered up to them through the platform. And those micro lessons are anywhere from like 2 to 3 minute lessons all the way up to about 5 to 6 minutes. The micro lessons are actually all built around animation as well. So we want to kind of take it so that some people are turned off by when they see other people. So we wanted to take that out of there and use animation so it's easier to consume.
So is there a real care provider on the other side then that's
Yes.
interacting with the patient?
So when I mentioned that collaborative platform, the provider that prescribed it actually has a dashboard. We can see the lessons that they're going through and how they're progressing through their assessments. Same dashboard that's used by the health coach. At the same time, the patient can actually create their own support network so that as they're going through the program, family and friends could actually get an email weekly that would show what that patient's doing so they can actually support them as well. So to really kind of get people to take control and be able to manage pain in this manner and turn that down, we really need a full ecosystem around them.
So who is it that would ultimately be prescribing this, or who is
the patient's provider would prescribe it. So primary care or pain clinic. Some of the areas we're looking at is specialty care like orthopedics and physical therapy is another spot that would essentially, if wherever people are experiencing pain, it fits. Those providers then, the system actually generates the billing codes and the medical record notes so that they can actually do the claims billing. So they get reimbursement from the insurance companies. We bill them for the use of the platform.
Thank you.
So what would the regulatory pathway for something like this be if it's going to be prescribed from the physician?
Think of it in terms of not like prescribing a medication. Think of it, it's almost like saying you need to go down the hall and meet with the physical therapist. That's what we mean by prescribing.
All right, thank you.